Relax those abs. Good. This side. There we go. Good. Hey everybody, Dr. Luke Stringer here down at Advanced Health Chiropractic in the South Loop of Chicago. I'm here with one of my fellow countrymen, Joe.
Hello, I'm Joe.
Joe's from Bath. He's a Southwest country boy. I'm a northerner from Manchester, but amazingly we're getting along. Anyway, Joe, if you could tell the viewers watching on YouTube, main reason why you came in, when it started, how it was affecting your function day to day, how you're feeling. And then, yeah, start there.
Okay, so I've had knee pain for about 2 to 3 years. It started after a half marathon and was kind of getting to the point where it was daily pain. So I come here to try and fix that. And I think, what was the second question? Sorry.
Yeah, well, Joe came over to play collegiate soccer on a scholarship, right?
Mm-hmm, yeah.
And then how was it affecting you playing soccer? And then obviously you're super active. How was the knee pain bothering you?
So I played through it playing football, which, you know, probably shouldn't, but I love running. I had to stop running, and then it was just hurting me day to day, so it was just getting a bit frustrating. Yeah, needed to be addressed.
So Joe's come into the practice, and he's thrown himself into it. We just completed 12 visits, but a blended approach of spinal adjustments, physical therapy, spinal traction based on some lumbo-pelvic misalignment. Joe's only done 12 visits, but considering you've had pain since 2021, how have you been feeling after 12 visits, Joe?
Well, yeah, we just did our exam here, and like you said, you've noticed a lot of improvement. The pain's definitely gotten better since I've come here, so yeah, definitely happy.
Yeah, Joe and I went through his exam. He's got better spinal alignment, better tissue tone. The biggest thing we've seen, objective findings. All the muscles are starting to engage better. He's moving better in his biomechanical assessments. So symptoms being the next thing, now you're functioning better. So what we're going to do, we're going to get Joe adjusted. It's going to be a lumbo-pelvic adjustment with the knee, the foot and the ankle. Then we're going to do some soft tissue treatment for Joe too. So if you want to get into it. Yeah. Joe, if you want to lay chest down for me. All right, guys, if you've watched our YouTube channel before, we warm all our patients up with what we call the arthrostim. This puts movement into the spine. When the spine moves, communicates to the brain, it hydrates this, but it also creates movement in the muscles that pick up on posture. When we started, Joe's legs were out of alignment. His right leg was short and his left leg by about an inch. He's in alignment. Pelvis is better alignment. So I need to do a little bit of improvement in regards to how his right SI joint function. We use the drop table to get that moving. We're going to check Joe's sacrum. So I want you to keep your right leg straight, Joe. Raise it up, down, left side, down. He's in good shape there. Now remember, your spine's a unit. Joe doesn't particularly have mid to lower back pain. But nerves here help control tissue tone, so this can help relax the muscle. You would have heard that with the mic. Joe got some great movement in his thoracics. Joe, lay on your right hip for me. So you're going to face me. Relax those abs. Good. This side. Joe's moving really well. There we go. On your back, Joe. All right, so now we're into phase 2 of Joe's treatment plan. We're seeing improvement both subjectively and objectively. Now we're going to ramp up treatment protocols. So this is a grafting tool, or an equivalent of it. Essentially it's a myofascial tool. And we're going to find what we call adhesion, which is like gluing a muscle. And it forms from injury and compensation. Joe's had knee injuries, a ton of compensation. You feel how that kind of feels like really gristly in there, Joe? Yeah, that's just adhesion. We just take the blunt edge of the tool and then we scrape out all the muscle pardon me, all the adhesion. We're working on what we call the Patellar tendon right now. Yeah, I'll get you out of here, Joe, in 3 minutes. Okay, we're now going to get into the quad, particularly the rec fem. It's the rectus femoris, anchors into the top of the kneecap. The idea of this is to break down adhesion. It's going to improve range of motion, also take care of symptoms. Joe's limited in flexion, which is bringing his heel into his butt. We need to improve that. Then we're going to get into all these muscles that in the vastus medius, which is a quad muscle. All right, so now we are going to traction Joe's knee. As you can see, Joe's knee's not quite getting to his heel. A lot of rotation in his tibia. So doing a traction. And we're going to adjust. Good. Now Joe's got some foot and ankle dysfunction. When he squats, when he was squatting, before we started treatment, he's anklet pronate, which would kind of kick in. We're cleaning that out, but we still need to work on what we call dorsiflexion. Dysfunction in your ankle can create knee, hip, low back pain. So we're just tractioning the ankle out. We're going to now adjust calcaneus, heel. Good. We're going to adjust what we call the talus, which drives a lot of pain in the ankle, knee, shin splints. Good. Alrighty guys, if you are a corporate athlete with a sports background, playing volleyball, soccer, going for a runs and you got pain, knee, foot and ankle, hip, low back, we can fix it. As you can see, we're doing with Joe. So if you're watching on YouTube, subscribe to the channel, turn on the notification bell. If it's Instagram, Facebook, like, follow the page. Joe, thank you.
Thank you very much.
Cheers, guys.
Thank you. Cheers.